is Selina Sufraz from the Park Clinic, just speaking to you about diet and nutrition, especially during lockdown. We recognise that the dental practice is shut and we're unable to see patients. We hope this information will be helpful in preventing any dental disease that may occur. During lockdown, we don't have our routine that we're used to. Children are being schooled at home. It's a difficult sort of timetabling issue, so you may find that people snack more, that children are helping themselves to things to munch on when they're peckish, and if you are working from home, you yourself might not be able to keep an eye on what they're putting into the mouth. So the main message of this is to try and avoid the stuff over here and go for the stuff over here. Sugar comes into contact with the bacteria that live on your teeth, create an acid, they create holes, and that's tooth decay. This is more likely to happen the more frequently you put sugar into your mouth. Limit the amount of sugar you have per day to no more than 4 exposures per day. So say breakfast, lunch, dinner and 1 snack. And when I talk about sugar, I mean free sugars. So free sugars are often added to things, so they're added to juices, they're often in yogurts. We all know they're in sweets and chocolates, but they're also in things like peach slices in fruit syrup, ice cream, and of course cereal. The other ones we may not be aware of is healthy looking canned fizzy drinks, juices and smoothies, and natural sugars like this. The only thing you should be snacking on in between meals would be non-sugary products such as fresh fruit, no problem at all, roasted nuts, preferably without salt, carrots and hummus, breadsticks, crackers. These are to demonstrate the different amounts of sugar that children are allowed per day. So 4 to 6 year olds allowed no more than 5 sugar cubes, that's 19 grams. 6 to 10 year olds should have no more than 6 sugar cubes, which is 24 grams, and 11 and over, so that includes us adults, no more than 30 grams per day, which is 7 sugar cubes. So if you were to pick up a couple of biscuits, have it with your cup of tea. If you look at this little box here and you have a look at the nutritional information, 6.4 grams per biscuit. So 2 biscuits is 12.8 grams, which is pretty much almost half an adult sort of sugar intake for the day. So do look at these things. Be careful with dried fruit and dried fruit bars. They tend to stick in the teeth. They are incredibly high in sugar and they can cause tooth decay. So try and have these straight after a meal if you do want to have them. Fruit juice and smoothies, limit to 150 mils per day. They're very sugary. Pop a straw in so it goes to the back of the mouth. If you're hungry, try and swap for alternatives. Alternatives such as 2 tangerines is 1 portion. Don't eat the whole bag of tangerines in one go. That's not good for your teeth either. So there are acidic foods and acidic drinks such as orange juice, fizzy drinks, wine, and most fruit are all acidic. They can cause acid erosion. Acid erosion is when the acid from the food that we put into our mouth and sometimes from our stomachs, such as gastric reflux, will dissolve and thin the enamel. If we brush our teeth within 1 hour of that, so if you're going to have orange juice for breakfast, don't brush your teeth straight away, wait 1 hour. Remember to use a straw. The acid thins the enamel. If we brush, then we thin it even more. That leads to sensitivity, especially with cold things, and it also leads to discoloration because the enamel goes thin and you can see the yellow dentine shining through. So be wary when you eat your fruit not to overdo it. So we're looking for 5 to 6 portions of fresh fruit and vegetables per day. I think during lockdown, possibly having some healthy snacks that are available so that the children can get at them if you're busy working from home and you can't be disturbed if you're on a call. Maybe peel some carrots and some celery and some cucumber, pop them in a Tupperware, pop them in the fridge, some small bits of cheese, Baby Bell cheese, a Marmite sandwich or a ham sandwich, something like that. Leave them available, tell the children this is what you can have for break time, or if you're peckish, have those, and have the biscuits and the ice cream and that sort of stuff straight after a meal. and remember to brush your teeth before you go to bed. Reduced saliva overnight means that the teeth cannot recover as well, so it's imperative that you brush your teeth before you go to sleep. So brush twice a day for 2 minutes. Spit and walk away, no rinsing, so the fluoride can protect the teeth. Reducing the amount of sugar daily. Having swaps to more tooth-friendly snacks. Reading the labels on some of the food and the snacks and the biscuits that we have. Limit the amount of sugar you have per day to no more than 4 exposures per day. Say breakfast, lunch, dinner and 1 snack. I hope everybody stays safe and we look forward to seeing you again soon at the Park Clinic.